Hello, and welcome to this month's WorkRite webinar on our brand new First Aid Refresher course. I'm Chris
Woohoo!
Jones. Hello, Ellie. I'm Chris Jones, Technical Director at Posturite, and as you've just heard, I have the one and only Ellie Hale, our WorkRite Business Development Manager, with us. How are you, Ellie, today?
Yeah, I'm very good, thanks, Chris.
Good, good, excellent. And so we're talking about first aid today, and I have to be very honest, although quite happy to sort of help people if they're in trouble. I don't know much about first aid myself,
I got my
I
first aid
this is
badge
going
in the brownies. That's the
excellent.
extent
So
of my first aid.
this will certainly be an education for me, and I hope for all you listeners as well. So over to you, Ellie. How's this
Absolutely.
going to work today?
Okie dokie. Well, I'm going to take you through our first aid refresher course. I think it's pretty obvious that Chris and I are not the Posturite first aiders at all. So basically, we developed this course. Some of our clients wanted to be able to provide their staff with refresher training, which is why we've developed this. So those that hold a first aid at work or emergency first aid certificate should ideally refresh their training annually. So this course will reinforce what you've already learnt, help you to maintain your basic skills, and keep you up to date with any changes to the first aid procedure. Note, though, that this course will not renew a 3-year first aid certificate or extend its validity period. So it's not instead of, it is as well as. I was talking to one of my colleagues
Do,
earlier about it. Oh, sorry, Chris. Yeah.
Sorry, Ellie. So does this actually replace any of the other courses you do? Because I know a lot of the staff in my office do something every year, but this doesn't replace the 3-year, but it does replace or help the interim top-ups
Help the
and that
refresher
sort of stuff.
training, yeah, yeah. So
Right.
we were
Okay.
talking to I was talking to one of my colleagues that looks after our face-to-face training, and she was saying that it's best practice to keep up to date, to keep topped up with your knowledge. And she said to me, and I hadn't really thought of this, but imagine if you were faced with a first aid incident, perhaps 2.5 years after you'd done your 3-day course, your initial course, and then you had to, with confidence, treat someone. Someone needed you to help them with first aid, and that must be really daunting, scary. And how do you know that you're providing the best care to whoever you're
Yeah.
looking after?
Yeah.
So we do have a face-to-face refresher course, which we advise people do annually. But we also have the e-learning when perhaps you can't get your staff together or you can't spare them out of the office, but you still want them to be able to keep their skills topped up.
Sure.
So there we go. So this is for all of you guys that have done your first aid training, and some of you, if you have not done your first aid training, you can still try and answer the questions. So think back to your first aid training. How many of you can remember? How much can you remember about the aims and responsibilities of first aiders? Imagine that you've arrived at the scene of an accident and established that the casualty has been struck by a falling object. What is the first thing you should do? And we've got a poll for you guys.
Okay, we do. So back by popular demand, I must make apology for last month where we couldn't have the polls last month, and a few people did point that out and were upset that
We
you
listen.
weren't
We
able
listen to
to
the public.
interact. We absolutely listened. So these are back today. So let's talk this through. So what is the first thing you should do? Well, I guess we
Should you
certainly want to be able to
treat
treat
the
it.
injury?
Well, we want to get to that bit as quickly as possible, I would have thought, but I wonder if there are things that we do need to do first.
Scan the scene
Fetching
for potential
fetching a
danger.
defibrillator is sort of a bit part and parcel of treating it, and I think putting the casualty in the recovery position is again, I'm guessing, from what I understand, being a first aider is as much about sort of protecting yourself as the person you're treating as well. So I would have thought it's scanning the scene for potential danger, and it looks like we've got a number of answers as well. So I'm going to close the poll now. Most people have put their answer in, and I can now also reveal the results, and we'll see what we've got. So Ellie, can you see that on your screen now? You possibly can't, but
Nope.
everybody else should be
How
able
did
to.
everyone do?
Well, we had 93% agreed with us or me. I'm not sure I actually asked your opinion. And it was scanning the scene for potential danger. So we had one or two that said treating the injury as quickly
That
as
is
possible.
correct. So the key aim of first aid is to preserve life. So survey the situation for further danger before you engage the casualty. The
Excellent. Okay, we're
three
doing well so far.
keys. An easy way to remember the aims of first aid is the 3 Ps: preserve life, prevent deterioration, promote recovery. So let's look at those 3 Ps in more detail. The ultimate aim of all medical care is to preserve life. As a first aider, you're asked to preserve the life of the casualty. Assuming there's no danger present, you should apply your knowledge of first aid to preserve the casualty's life. This may involve controlling blood loss or performing CPR 32, for example. Prevent deterioration. You should apply your knowledge of first aid to prevent deterioration in the casualty's condition. For minor injuries and afflictions, this may be as simple as making the casualty comfortable and preventing further harm. In serious cases, such as a heart attack, your best efforts to prevent deterioration give the casualty a stronger chance of survival when the emergency services arrive. The third aim of first aid is to promote recovery. Calling the emergency services early is crucial in this regard. Your efforts can have a profound effect on a casualty's subsequent recovery. Preventing a wound from becoming infected or guarding against further injury are both examples of effective first aid promoting recovery. Common hazards. It's prudent to ask yourself what kind of injuries might arise from the hazards in your workplace and how these risks could be controlled. So, work at height must be adequately planned and undertaken using the correct training and equipment. Falls and injuries from falling objects can be extremely dangerous. Machinery should be serviced and inspected at appropriate levels. Safeguards should be put in place where necessary. Operators must ensure that no loose clothing, jewelry, or hair can become entangled in machinery. Workers who lift objects as part of their job should be trained to do this safely. Even items you'd not consider to be heavy can place considerable strain on the back if lifted or held incorrectly. Surfaces that are uneven or liable to become wet are a hazard. Loose cables and ill-fitting carpets should be dealt with, and spillages cleared up promptly. Vehicles should be serviced and inspected as is appropriate. Moving vehicles present a danger of collision, while insecure loads are a hazard to other road users. Your place of work should have an effective practice plan to raise the alarm and evacuate all occupants in the event of fire. Fire presents a danger of smoke inhalation as well as burns. Hazardous substances can cause poisoning, burns, and other serious injuries. Ensure they are safely stored and used. Poorly maintained equipment and unsafe practice can result in electrocution, burns, and loss of consciousness. So guys, test your memory. The 3 Ps. What are the 3 Ps? Is it preserve life, protect yourself, promote recovery? Or is it preserve life, prevent deterioration, and promote recovery?
Well, I've launched the poll, Ellie, and we'll see what people say. But I have to say, I did notice you repeat the word deterioration.
Because I'm having like tremendous trouble with pronouncing the word. I don't know why.
I did sense there was a slight chuckling voice at the same time. I'm
like applauding myself every time I manage to say it correctly.
So I'm certainly going to pick that. I think your speech reinforced the learning for me particularly.
I gave it away. Oh, you guys, sorry. Did everyone get it right?
I'll share that now, and so that's 86% of us remembered that you that stuttered on that particular word. So, so thank you, Ellie, for allowing us to do that one. So
the 3 Ps are preserve life, prevent deterioration, and promote recovery. I'm going to practice that lots later. Here we go. So managing the situation. Assessing the situation for danger. The role of the first aider is to provide safe, prompt, effective care and to perform life-saving procedures if necessary. Your first action should be to assess whether it's safe to intervene. For example, entering a burning building would put a first aider at risk. So think back to your first aid training on how to approach a casualty situation. Imagine you arrive at the scene of an incident where somebody's broken their arm. You have surveyed the scene for danger and it's safe to proceed. What should your next action be? Is it support the fractured arm, or is it ask for the casualty's consent to receive first aid?
Okay, well, we'll launch the poll again. my immediate, without being trained, my immediate guess would have been to, start
To go and
supporting
help.
it first and go and help. And I'm not sure whether supporting the fractured arm counts as giving first aid, but I guess in the world of litigation and blame that we're in nowadays, I'm guessing before we do anything, we should ask for help, ask the casualty for their
So
consent
what you really want to
first.
do is rush to them and give them a cuddle, but first perhaps
Yeah,
ask if
exactly.
they're okay with that.
Okay, so let's just see what happened there. So yes, absolutely, we should ask first. 20% of us did think that it was to support the fractured arm, and 81% was to ask for consent. So there we are.
There we
Good.
go. So step-by-step action. If the situation is safe, proceed through the following steps. Casualty consent, primary assessment, the need for vital action, secondary assessment, minimizing infection, and reporting incidents. You must always ask the permission of the casualty before administering first aid, even if the casualty seems to be unconscious. You need to seek permission from the casualty prior to administering first aid if they are conscious. If they're unconscious, or in a life-threatening situation, you should assume that they would accept assistance. It's likely that most people would assent to your help were they conscious. You probably would in such a situation too. You should proceed with first aid on this basis. If the casualty is under 18, you should seek permission from a parent or guardian first. And casualties are of sound mind, but refuse treatment must have their wishes respected. Otherwise, intervention could be considered assault. God, imagine that, trying to help someone. So always ask permission first. Administering basic first aid to a casualty immediately following an accident can be the difference between life and death. You can memorize the order in which to act by using the acronym DRAB or Dr. Ab.
That sounds like a Mr. Fitness type
Look,
expression instead.
Mr. Motivator.
Exactly, that's what I was thinking of. Yeah.
So, danger. So first, check that it's safe to approach. Remember, do not put yourself or others at risk. Check the casualty for a response. Gently tap the collarbones whilst talking to see how responsive they are. Ask for details about what happened. If in doubt, seek professional help. If the casualty is unresponsive, attract attention by calling for help. Open the casualty's airway by gently tilting their head back and lifting their chin. And are they breathing? Check by looking and listening for 10 seconds. If the casualty is not breathing, you must take vital action. Summon professional help by calling an ambulance and then perform CPR 32. If the casualty is breathing, begin a secondary assessment. If in doubt as to whether the casualty is breathing, commence CPR. So imagine that you're called to an accident in an office. There's a casualty on the floor. How should you proceed?
Okay, well, let's launch this poll, and it was only one slide ago, but I have managed to forget what was on the previous screen, so we're going to have
It's
to have a
tricky.
good
They're
think
quite
about this.
similar.
They are very similar. So we know that the last two things are airway and breathing, so it's all about the first two parts. And
Is it determined response? Is it danger rescue? Is it danger response?
well, I'm guessing it's checking for danger first, and then this is where I struggle.
Were you listening to me, Chris?
Well, Ellie, you might have caught me out. I'm going to go for option number two, and that is danger, rescue, airway, breathing. But we will see. It doesn't look like everybody else agrees with me. So
What's everyone else said?
I was trying to be very honest here, and clearly got it completely wrong because nobody thought that. So I'm guessing that they were listening to you.
It's incorrect.
So we had 88% thought that exact answer that you've just shown on the screen. So well done, everybody
Danger,
else.
response, airway, and breathing.
Nobody agreed with me, but let's carry on.
In some situations, it's imperative that you perform life-saving action immediately. This is the case if you observe no evidence of breathing, no circulation, or heavy blood loss. Where there is a need for vital action, you may need to perform immediate CPR 32, use a defibrillator, or stem blood flow. Those helping you should immediately call an ambulance. If you have no help, try to call an ambulance before administering first aid. Protect yourself and the casualty from infection. Germs can be transmitted both ways. Here are some points to consider. Do not touch a wound with your bare hands. Do not touch any part of a dressing that will come into contact with the wound. Cover your own cuts and grazes with waterproof dressings. Gloves are available in all first aid kits. If these are unavailable, plastic bags may help. Bloodborne viruses such as hepatitis B, C, and HIV can be transmitted through a cut or a graze. If dealing with large quantities of bodily fluids, try to wear an apron and goggles. Wash your hands thoroughly before and after administering first aid, then use alcohol gel if available, and dispose of all waste safely. You've got a legal duty to report and record injuries and accidents and cases of work-related disease. So why are you keeping a record? Well, it's to help identify any patterns occurring and help you complete risk assessments. Some insurance companies may also require this information when presented with a claim. The information should include the date, time and place of the incident, the name and job of the injured or ill person, details of the injury, illness and first aid given, what the casualty did immediately afterwards, for example returning to work or going to hospital, and the name and signature of the person reporting the incident. All information must be kept in accordance with the Data Protection Act 1998. So, imagine that you discover an unresponsive casualty in a shopping centre car park. On examining the casualty, you find they're not breathing. The emergency services have not been alerted. Bystanders are gathering. What should you do? I'd probably panic first.
Yeah. Well, I mean, referring back to a previous question, it'd be probably quite difficult to ask for their permission if they're not responsive as well, which is an interesting point. But I
So you
guess
just assume, judged on the basis of the reasonable man, that they would accept your
indeed,
help.
indeed. What can we do? We can call the emergency services first, then perform CPR 32.
I'd certainly be the one running back into the shopping centre to find someone else to look after it.
Well, this is finding an AED, so that's for finding a defibrillator, or perform CPR while a bystander calls for the emergency services, or drive the casualty to hospital. Well, I'm guessing that actually option 3 means we can effectively do 2 things at once, rather than calling the emergency services first and then performing CPR.
Use the
So
help while you've got it.
I'm gonna 3, so let's see what everybody else thought. Well, it was 81% of us all thought that we should use a bystander to call for the emergency services while we perform the CPR.
CPI?
But 19% of us did think that calling the emergency services was the first thing that we should do. So let's see what the answer is, Ellie. Okay, there we are.
32 while a bystander calls the emergency services. Use the help while you've got people there to help you, I think. So this section has refreshed your knowledge of how to assess and manage a first aid situation effectively. Remember, always establish whether it's safe to intervene before doing so. Ask for consent before administering first aid. Use DRAB, or Dr. AB. Danger, response, airway, breathing to remember the procedure for a primary assessment. Take care to minimize infection and always record any incidents. The following sections will look at some common first aid emergencies. Resuscitation. So imagine you discover an unconscious casualty. You assess the situation as safe, find the casualty to be unresponsive, and tilt their head back to open their airway. Now you should check if they're breathing. You should look, listen, and feel for breathing for up to 10 seconds, 1 minute, or 10 minutes.
Okay, I'll launch the poll again. Right, well, we've not. This is a tricky one. I would imagine 10 seconds probably feels like about 10 minutes if you've got someone that's in trouble. I can't imagine. I mean, a minute would be an incredibly long time to effectively wait and not do nothing because you're observing, but there'd be no action being taken in that minute, which is from.
I think 10 minutes would make you a rubbish first aider.
Yes, and certainly from the defibrillator training that I did once have, that was, seconds count, I think, was the primary lesson that they were trying to make. So I'm going to go for 10 seconds. Do you agree, Ellie?
I do.
Okay.
What's everyone else saying?
So we had We had 3%, say 10 minutes. It's interesting,
Oh,
which
guys,
is a long time. 14% said a minute, and 83% were at that 10-second mark, which I'm guessing you're going to reveal the
that is
answer, Ellie.
correct. If the
Correct, 10
casualties stop
seconds.
breathing, you need to take vital action. Look, listen, and feel for breath to quickly establish whether the casualty is breathing within 10 seconds. Good to know. When delivering first aid, it's important to marshal the help of those around you. A bystander can alert the emergency services, freeing you to attend the casualty. Bystanders can fetch first aid supplies such as a defibrillator. They can also accelerate the arrival of emergency medical services by clearing obstructions such as parked vehicles and directing responders to the exact location of the casualty. If nobody is nearby, you must alert the emergency medical services yourself. Shout for help and ensure that the emergency medical services are en route. Then deliver cardiopulmonary resuscitation. Remember,
Well done.
CD. Thank you. Compressions. Commence CPR 32, so that's 30 chest compressions followed by 2 breaths, and the defibrillator. Ask a bystander to bring an automated external defibrillator, an AED, if one is available. So, the aim of CPR is to keep oxygenated blood circulating around the body. Continue administering CPR 32 until the casualty shows signs of life or the arrival of emergency medical help. Adult resuscitation. So how should you perform CPR 32 on an adult? Start with chest compressions. So use the heel of your hand in the center of the casualty's chest and perform 30 compressions. This circulates oxygenated blood around the body and the vital organs. And then the chest compression should be at a rate of 120 beats per minute. This is approximately 2 per second. The compressions should reach a depth of 5 or 6 centimeters. I heard actually that you do it to the rhythm of Another One Bites the Dust. I don't know if that's totally appropriate, but
And I actually
that's true.
I had match of the day, so but that was a while ago, so maybe the advice has changed a bit, and then I'm not sure what pace that is. So
There we go.
yeah.
But keep the rhythm. And after 30 chest compressions, give the casualty 2 breaths. Do this by gently lifting the chin and pinching the nose, sealing your mouth over theirs and breathing out. Check that their chest rises. This moves air in and out of the lungs to provide the casualty with oxygen. If you're unable to give 2 breaths or don't feel confident, you must continue with chest compressions. Ask for help. You may deliver CPR 32 less effectively as you become physically tired. It's an extremely strenuous technique. If a bystander is present, ask for help. Instruct them in chest compressions only and alternate between you every 2 minutes. And resuscitation for babies and children. Open the child's airway by gently tilting the head back and removing any obstructions from the mouth or nose. Pinch their nose and seal your mouth on theirs. Give 5 initial rescue breaths before continuing with CPR. Breathe steadily and firmly, checking their chest rises. CPR 32 at a rate of 100 to 120 beats per minute. Compress the chest by at least 1/3 of the depth of the chest. For babies, use 2 fingers placed in the middle of the chest. If you cannot compress the chest by 1/3, use the heel of your hand. For children over 1 year, use 1 or 2 hands as required. It's common for a non-breathing casualty to vomit whilst collapsed. You can identify that the casualty has vomited by listening as you perform CPR 32. The casualty might make a gurgling sound when the rescue breath is being expelled. If the casualty has vomited, turn them onto their side away from you to allow drainage and clean their face and then recommence resuscitation. If the casualty is breathing, check for any major bleeding and obvious signs of injury. If none are present, place the casualty in the recovery position. So lower arm outstretched, hand upward to prevent rolling. Upper arm bent so that the back of the hand touches the cheek, supporting the head. Bend the farthest knee at a right angle. Pull it towards you and roll them onto their side. Head tilted to open airways. And stay with the casualty and monitor their breathing. Move them onto their other side after 30 minutes if their injuries allow this. Imagine that you're called to resuscitate an unconscious adult. What depth should the chest compressions reach? Is it 5 to 6 inches, 5 to 6 centimeters, or 3 to 4 centimeters?
Okay, question time again, and the answers are coming in thick and fast this time. And I've happened to have a glance, and I do actually remember this was just quite a few slides ago. It was, I think, 5 to 6 centimeters.
Has everyone
And
answered?
we've got most people have answered now, so I will close the poll and let's see how everybody did. We had 9% were 5 to 6 inches, 9% were 3 to 4 centimeters, and 82% of us voted for 5 to 6 centimeters, which I'm assuming, if my memory and everybody else is served correctly, then yeah, absolutely. So it was 5 to 6 centimeters.
Chest compressions, yeah.
Yeah.
Super. So this section's covered how to resuscitate a casualty. It's important to quickly establish whether or not the casualty is breathing. Remember CD if a casualty is not breathing. That's compressions and defibrillator. When performing CPR 32, make sure you compress the chest to an adequate depth. Use the recovery position when the casualty is vomited, or if they're breathing and their injuries allow. So now let's look at external bleeding and shock. If the casualty is bleeding at a significant rate, you'll need to take vital action. This section will refresh your knowledge of the types and effects of external bleeding to prepare you to administer first aid. So, what of the following signs indicates arterial bleeding? Is it a pool of dark red deoxygenated blood? Is it oozing from the wound? Or is it a bright red spurt of oxygenated blood?
Ooh, well, what do you think, Ellie?
I'm trying to think of my casualty knowledge. I've watched that for years.
I've never been a casualty watcher, but
When people have, been in the warehouse and then accidentally had a cable slash an artery, I'm trying to think,
yeah,
was it dark red or was it bright red? Probably it was spurting.
I would have thought it's going to be coming out quickly, isn't it? So we'll definitely go for a spurt, shall we?
Yeah.
Excellent. Okay, fine. So let's see what everybody else thought. So we'll share that, and yeah, 97% went for a bright red spurt of oxygenated blood. So we did have 3% saying a pool of dark red deoxygenated blood, but I'm guessing the arterial bleeding is the bright red spurt.
Because the arteries propel bright red oxygenated blood around the body with great force. Arterial bleeding is usually characterized by a bright red spurt of blood.
Well done, everybody.
Here we go. If a casualty is bleeding heavily, call the emergency medical services as soon as possible. Apply pressure to the wound. Use sterile dressings where possible to stop or slow blood loss. Maintain the pressure until emergency help arrives. You can diagnose the type of bleeding through observation. There are 3 types of bleeding. Arterial, the bright red oxygenated blood that spurts from the wound in time with the heartbeat. So this is the most dangerous type of bleeding. Venous. Venous? Is that how I'd say it?
That's how I pronounce it, but neither of us are first aid trained, Ellie, so we'll have to refer to greater powers if they would wish to correct us. So, but we'll go for venous.
Please let us know if I've just pronounced that wrong, guys. Dark red blood will gush from the wound or pool at the site of the wound, less dangerous than the arterial bleeding, but still very serious. And then the capillary. Oozing occurs at the site. It's usually not serious and it's easy to control. In all cases of bleeding, you should protect yourself from infection. Use gloves or any protection you can find. Use the SEPD acronym to remember how to treat external bleeding. So, sit the casualty down to prevent them from falling and to allow them to rest the injured body part. Examine the wound for any embedded objects. If present, do not remove. Apply firm pressure to the wound to stem blood loss and aid clotting. And then use a low adherence dressing. If it becomes saturated, apply a second dressing. If the second becomes saturated, remove all and reapply. Hemostatic dressings. These dressings contain an agent which safely and rapidly clots the blood when direct pressure does not control life-threatening bleeding, such as neck, groin, or abdomen. Training is required to ensure safe and effective application. So to apply an hemostatic dressing, tightly pack the entire wound with the dressing and compress for at least 5 minutes. Repeat if bleeding persists. Once bleeding is controlled, cover the dressing with an ordinary bandage. Send the dressing packet to hospital with the casualty. Tourniquets. There are several key points to remember when considering the use of tourniquets. It's important to note that training is essential to ensure safe and effective application. They should only be used where direct pressure does not control life-threatening bleeding to a limb. Apply at least 5 centimeters above the wound. Tighten until bleeding is controlled. Application is painful, and the casualty should be advised and reassured. A second tourniquet or hemostatic dressing may be required where bleeding is not controlled. Note the exact time of application and ensure that information is passed to emergency services. Hypovolemic shock. Hypovolemic shock. This condition is caused by a failure of the circulatory system to provide vital organs with oxygenated blood due to insufficient blood volume. It's a life-threatening condition. Signs of shock include pale, cold, and clammy skin, rapid and shallow breathing, rapid and weak pulse, weakness and dizziness, and nausea and vomiting. Dial 999 or 112 for emergency medical assistance immediately upon recognizing shock in a casualty. It's an extremely serious condition. You should treat any obvious injuries, lay the casualty down, raise and support the legs, loosen tight clothing, keep the casualty warm by wrapping them in a blanket, for example, and monitor their response levels. Do not give the casualty anything to drink. If you're attending a casualty who's displaying signs of hypovolemic shock, how should you proceed? Give the casualty something to drink and reassure them, or call the emergency services, treat any obvious injuries, raise and support their legs, and keep the casualty warm.
Okay, those are the last question we've got, so let's make it a good one. So, how should we proceed? Give the casualty something to drink and reassure them, or call the emergency services? I think it's got to be get on the phone straight away, isn't it, Ellie? And let's get some real help here, because I don't think giving them a drink and reassuring them, it sounds like memories from school days when you had any sort of injury. You went to first aid at the school, and it was a wet paper towel on the head and a paracetamol, and that was about it. Yes. So,
although I still think my first instinct would be make anyone a cup of tea. If someone looked shocked, I'd say sit down, have a cup of tea.
The answer to everything, yeah, absolutely. Right, let's see what everybody else thought. So we had, not only did we have nearly everybody vote, we also had 100% of people voted for calling the emergency services, Brilliant. Which is excellent. So we are
You should never give a casualty something to drink if they are suffering with hypovolemic shock. Call the emergency services, treat the casualty as appropriate, and monitor the situation. So this summary has refreshed your knowledge of treating external bleeding and shock. Remember to alert the emergency medical services as soon as possible. Apply and maintain pressure on the wound, and use the SEPD acronym: sit or lay, examine, pressure, and dressing. Now we're going to move on to choking. This is slightly different, guys, the setup of this, because the process is quite complicated depending on what's happening. So, if there's a partial obstruction, encourage the casualty to cough and do not use back blows. And this is the action for a conscious choking adult. Is the casualty choking? Yes, then you can give up to 5 back blows. Is it successful? No, then you can give up to 5 abdominal thrusts. So you reassure the casualty and seek medical help if in any of these situations. But there's a slightly different process with a child. If there's a partial obstruction, encourage the casualty to cough, do not use back blows. And it's important, if there's no improvement, remember, always call the emergency services, go to 999. And for a choking baby, Is the casualty choking? Yes. Give up to 5 back blows. Is it successful? No. Give up to 5 abdominal thrusts, but obviously with a slightly different process with the baby, if you can see from the images there.
And it's checking the mouth and removing visible objects as well. I think is quite an important part of that.
You would know about all the babies, Chris. You are the expert when
I
it
should
comes to
have,
dealing
you
with them.
uh, fortunately not had to deal with too many choking incidences, but there have been some.
So the action for an unconscious choking adult: support the casualty to the ground, send a bystander to call emergency services, or go yourself if you're on your own. Start CPR immediately with 30 chest compressions. Give 2 effective breaths. If they are not effective, continue with chest compressions. Continue CPR. 30 compressions and 2 breaths. Continue until the casualty shows signs of consciousness, help arrives, or you are too exhausted to continue. And that's it, guys. That's our first aid refresher course. And as always, they would then take a test to prove their knowledge. So this course is really aimed at giving your staff confidence in their task, which is what training's all about, really. It's going to make them feel more confident. It's not just about, I mean, you have to have first aiders on board, but this course isn't just about ticking a box. It's about supporting your staff in their role as first aider and making sure that they've got some support and some learning that they can do in between the 3-year compulsory training.
I guess one of the great things about this as well, Ellie, is the fact because it's online, actually first aid advice does change from time to time. And I believe the 32, the CPR 32 has changed over the years as well as to the number of compressions to breaths. And so actually if this is rolled out among a number of staff, actually as the advice changes, they can repeat the training and actually get updated between their 3-year the 3-year full courses as well.
Yeah, absolutely. So as always, if this is something that's of interest to you guys and you'd like to add it to your WorkRite system, contact us. Or if you're not an existing WorkRite customer and you're interested also, give us a call and we can talk you through it.
Excellent. Thank you, Ellie. And
No
for
problem.
everybody that's listening today, have a great Christmas. We will be back in January with another session. I
Happy
don't have a note of
Christmas.
what that is to hand, but it will. I'm sure we'll
Food
have
safety.
food safety. Excellent. Okay. Good. Good. Super. Happy Christmas. Happy Christmas to you too, Ellie. And see you in January.